Hi, I'm Adam Bernard. I'm a physical therapist and clinical director here at Balanced Physical Therapy, PRUNEDALE. One of the most common orthopedic injuries we experience in the clinic is going to be something with the rotator cuff. You might have pain in the front of your shoulder, pain going down the side of your shoulder, and it might even progress to numbness and tingling down into your fingertips. So I'm here to show you some common ways to avoid injury to the rotator cuff and how to prevent injury moving forward. Now, the rotator cuff is a group of 4 muscles that are around the head of the humerus, your upper arm bone right here. Their main job is to hold the head of the humerus up into what's called the glenohumeral joint, and to prevent that from moving around too much to rub up against the other structures that are in close proximity to it. Now, one of the most common ways that the rotator cuff can become impinged or injured is with rounded shoulders. Now, we see this really frequently with our activities of daily living, with driving, with writing, typing, and doing things frequently out in front of us. Now, what you want to do is maintain your scapula, your shoulder blades, retracted and depressed while you're doing those activities out in front of you. A lot of my patients that I see throughout the day have a slight rounded shoulders, or what's called a increased thoracic kyphosis. So you want to prevent that hunched shoulder look and keep extended with your shoulders pulled back and down. Now, the scapula is a triangular shaped bone on the back of your thorax right here. It has 2 little bony fingers that protrude forward. Now, those provide kind of the back and the roof of the glenohumeral joint. The floor, what I like to call it, is the humerus, the upper arm bone, and the roof are those bony fingers that protrude anteriorly or towards the front of your body. Now, in between the floor and the roof, you have the rotator cuff muscles, 2 of them, and then you also have the neurovascular bundle going down. So if our shoulders are rolled forward, the highest I can lift my arm is right there. Now, suddenly, if I retract and depress my shoulder blades and extend my back, now I have full range of motion of my shoulder, and those structures aren't being impinged or pinched upon in the shoulder. Now, if we spend a long time or we have our career that requires us to do our work in front of us, those structures over time can get injured and they can even become frayed or torn. So I'm going to show you a couple exercises that you can do in the privacy of your home or office to keep those shoulders pulled back and down and get you moving throughout your day. So for postural retraining, I like to focus on 4 main exercises before we move into more difficult exercises. The first of which is a cervical retraction, or pulling your head back. And what I want you to do is, while seated or standing, imagine the bottom of your jaw is on a shelf and you're sliding your chin backwards, almost making that double chin right there. You can do a set of 15 to 20 of these. Pull it back, hold for a second or 2, and then relax. Pull back, hold, relax. What you're trying to do is feel the burn in these muscles that are up in front of your neck right here, and over time you want to keep your head pulled back. The second exercise is what's called a scapular retraction. Again, those scapula are your triangular shaped bones on the back of your body, and you want to keep them pulled back. So what we do is we sit or stand, and you want to pull your shoulder blades back and pinch them together. Sometimes I'll put my fingers on someone's spine and in between their shoulder blades, and I'll ask them to pinch my fingers. So you pull those shoulder blades back, hold a second or 2, and relax. Now, the third exercise is what's called a glenohumeral external rotation, or I like to call them a why not. So what you do is, while seated or standing, keep your elbows attached to the side of your body. Make sure you have a 90-degree angle at your elbow, and also with your shoulder against your body, like that. And you want to keep your forearms parallel to the ground. Initiate this move with your shoulder blades. So pull your shoulder blades back, and then externally rotate your arms. When you do this exercise, be sure that you don't chicken wing or have the elbow come away from your body, like so. The fourth and final exercise is what's called a horizontal abduction, or some of the weightlifters might call this a reverse fly. So standing nice and tall, you can also do it seated. Keep your shoulders pulled back. Bring your wrists up to the level of your shoulders, so you want your wrist, elbow, and shoulder all in line. Start with the proud chest and shoulder blades retracted. Pinch your shoulder blades together and pull your arms back. You can do a set of 10 to 12 of these and try to pinch at the end. After all 4 of these exercises, you might feel a little bit fatigued or a little sore in the front of your neck and also between your shoulder blades. But if you continually do these exercises throughout the week and maintain that posture throughout the day, you can prevent further injury later on and keep you moving going throughout your day. Now, if you found this video helpful, you can help us out by following us on Instagram at BalancePTMove, or you can visit our website at balancept.com. Thanks so much, and we'll see you out there.